Hello everyone, welcome to our channel. Today we are going to talk about something very important for all of us as we get older, our eyes. Our vision allows us to enjoy so many things in life. It lets us see the faces of our loved ones. It helps us read a good book. It guides us when we are walking or driving. Keeping our eyes healthy is very important for maintaining our independence and our quality of life. As we age, our eyes change, just like other parts of our body. Some changes are normal, but some can be signs of more serious conditions. Two common eye conditions that become more frequent as we get older are cataracts and glaucoma. Now, these words might sound a bit scary, but they do not have to be. The most important thing to remember about both cataracts and glaucoma is that early detection can make a huge difference. Catching these conditions early, before they cause too much trouble, means that we can often manage them well. It means we can protect your precious sight. So today we will break down what cataracts and glaucoma are in simple terms. We will talk about what symptoms to look for. And most importantly, we will discuss why regular eye checkups are your best defense. Let us start with cataracts. Many people have heard of cataracts, or perhaps they know someone who has had them. So what exactly is a cataract? Imagine your eye has a natural lens, much like the lens in a camera. This lens is usually clear. It helps focus light onto the back of your eye, allowing you to see things sharply and clearly. A cataract is simply when this clear, natural lens in your eye becomes cloudy. Think of it like looking through a window that has become foggy or dusty. Things just do not look as clear or bright as they used to. They might look hazy or blurry. Cataracts usually develop slowly over time. At first, you might not even notice any changes in your vision. But as the cataract gets larger or thicker, your vision will likely become more affected. So how do you know if you might have a cataract? There are several common symptoms to watch out for. One of the most frequent complaints is blurry or cloudy vision. Things just do not seem as sharp as they once did. Another common symptom is difficulty seeing at night. You might find it harder to drive after dark, or you might notice more glare from oncoming headlights or streetlights. Colors might also start to look faded or yellowish. That vibrant red flower might look more like a dull orange, or that bright blue sky might appear a bit washed out. You might also notice increased sensitivity to light. Bright sunlight or indoor lights might feel more uncomfortable or glaring than before. Sometimes people with cataracts might see halos around lights. Imagine circles of light around streetlights or car headlights at night. Another symptom can be frequent changes in your eyeglass or contact lens prescription. If your vision keeps getting worse and your glasses need constant updating, it could be a sign. Sometimes double vision in one eye can also occur. It is important to remember that these symptoms can also be caused by other eye conditions. That is why it is so important to see an eye care professional for an accurate diagnosis. So, what causes cataracts? The most common cause is simply aging. Cataracts are a natural part of getting older for many people. As we age, the proteins in our eye's lens can start to clump together, making the lens cloudy. But age is not the only factor. There are other things that can increase your risk of developing cataracts. One significant risk factor is exposure to sunlight over many years, especially without proper eye protection. This is why wearing sunglasses that block harmful UV rays is so important throughout your life. Smoking is also a big risk factor. Studies have shown that people who smoke are more likely to develop cataracts, and they often develop them earlier in life. If you smoke, quitting is one of the best things you can do for your overall health, including your eyes. Certain medical conditions can also increase your risk. For example, people with diabetes are more prone to developing cataracts, and often at a younger age. Injuries to the eye, previous eye surgery, or even long-term use of certain medications, such as steroids, can also contribute. So how are cataracts detected? This goes back to our main message: early detection. Cataracts are primarily detected through a comprehensive eye exam performed by an eye care professional. During this exam, your doctor will check your vision and examine the structures of your eye. A very important part of this exam for detecting cataracts is the dilated eye exam. This is when your doctor puts special eye drops into your eyes. These drops make your pupils, the black centers of your eyes, open wide. This allows the doctor to get a clear view of the lens at the front of your eye and the retina and optic nerve at the back. It is like opening a door wider so they can see everything inside clearly. During this dilated exam, your doctor can easily see if your natural lens is cloudy or if a cataract is forming. They can also assess how much it is affecting your vision. So, what happens if you are diagnosed with a cataract? In the very early stages, when a cataract is small and not bothering your vision much, you might not need any immediate treatment. Sometimes simply updating your eyeglass prescription can help improve your vision for a while. Stronger bifocals or anti-glare coatings on your glasses might make a difference. You might also find that brighter lighting helps you see better. However, as cataracts progress and start to significantly interfere with your daily activities, such as reading, driving, or recognizing faces, surgery is the most common and effective treatment. Cataract surgery is one of the most frequently performed surgeries in the world. It is considered a very safe and effective procedure. During cataract surgery, the cloudy natural lens is removed. It is then replaced with a clear artificial lens called an intraocular lens, or IOL. This new lens stays in your eye permanently. The surgery is usually done on an outpatient basis. This means you do not usually have to stay in the hospital overnight. It is often done with local anesthesia, meaning you are awake, but your eye is numbed. You might feel some pressure, but typically no pain. The recovery period is usually quick. Most people notice an improvement in their vision almost immediately, or within a few days. You might need some eye drops to help with healing and prevent infection for a few weeks after surgery. You will also have follow-up appointments with your eye doctor to make sure everything is healing well. After cataract surgery, many people report that colors appear brighter and clearer. Their vision is sharper, and they can enjoy their daily activities with more ease. It can truly be a life-changing procedure. So, that is a good overview of cataracts. Now, let us move on to the second important eye condition we are discussing today: glaucoma. Glaucoma is a bit different from cataracts. While cataracts involve a clouding of the eye's lens, glaucoma involves damage to the optic nerve. The optic nerve is like a cable that connects your eye to your brain. It carries all the visual information from your eye to your brain, allowing you to interpret what you see. Imagine this optic nerve as a very important pipeline. In most cases of glaucoma, this damage to the optic nerve happens because of high pressure inside the eye. This pressure builds up when the fluid inside your eye, called aqueous humor, does not drain properly. It is like a sink that is slowly clogging up and overflowing. The pressure gradually pushes on and damages the delicate optic nerve. If the optic nerve is damaged, it cannot send clear signals to your brain. This leads to vision loss. Now, here is a very important point about glaucoma. It is often called the silent thief of sight, and there is a very good reason for this nickname. In the most common form of glaucoma, called open-angle glaucoma, there are often no symptoms in the early stages. You do not feel any pain. You do not notice your vision getting blurry right away. The vision loss that occurs with glaucoma usually starts on the edges or the sides of your vision. This is called peripheral vision. Because we tend to look straight ahead and our other eye can compensate, we might not notice this side vision loss until a significant amount of damage has already occurred. It is like slowly losing the edges of a picture without even realizing it. By the time you do notice symptoms, such as significant blind spots or tunnel vision, where it feels like you are looking through a narrow tube, the damage to the optic nerve is often quite advanced. And unfortunately, vision loss from glaucoma cannot be restored. That is why early detection is so critical with glaucoma. It is the key to preserving the vision you have. There are different types of glaucoma, but open-angle glaucoma is by far the most common. It develops slowly and silently, as we just discussed. There is also angle closure glaucoma, which is less common. This type can cause sudden, painful symptoms like severe eye pain, headache, blurred vision, and halos around lights. This is a medical emergency and requires immediate attention. But for the purpose of this discussion, we will focus on the more common silent open-angle glaucoma, because it is the one that often goes unnoticed. So who is at risk for glaucoma? Just like with cataracts, age is a major risk factor. The risk of glaucoma increases significantly after the age of 60. Family history also plays a very important role. If your parents, siblings, or grandparents had glaucoma, your risk is much higher. This is because certain types of glaucoma can run in families. High eye pressure, as we mentioned, is the main risk factor for optic nerve damage. However, it is important to know that not everyone with high eye pressure will develop glaucoma, and some people can develop glaucoma even with normal eye pressure. This is why regular monitoring is key. Certain medical conditions such as diabetes, heart disease, high blood pressure, and sickle cell anemia can also increase your risk. Being of African, Hispanic, or Asian descent also increases the risk for certain types of glaucoma. Long-term use of certain steroid medications, especially steroid eye drops, can also increase eye pressure. So, how is glaucoma detected? Because it is often symptomless in its early stages, regular eye exams are the only way to catch it early. During a comprehensive eye exam, your eye care professional will perform several tests to check for glaucoma. One common test is measuring your eye pressure. This is usually done with a gentle puff of air or by gently touching the eye with a special device after numbing drops are used. This test gives your doctor an idea of the pressure inside your eye. Another crucial part of the exam is examining your optic nerve. After your pupils are dilated with eye drops, your doctor will use a special instrument to look at the back of your eye. They are looking for any changes or damage to your optic nerve that might indicate glaucoma. They might also take a picture of your optic nerve to track changes over time. A visual field test is another important tool. This test checks your peripheral vision. You will look into a dome-shaped instrument and press a button every time you see a faint flash of light. This helps your doctor map out your field of vision and identify any blind spots. Another test that might be used is called optical coherence tomography, or OCT. This advanced imaging test takes very detailed pictures of the layers of your optic nerve and retina. It can help detect very early damage to the nerve fibers that might not be visible during a routine examination. Regular comprehensive eye exams are truly the cornerstone of early glaucoma detection. So if glaucoma is detected, what are the treatment options? While vision lost from glaucoma cannot be recovered, treatment can help prevent further vision loss. The main goal of glaucoma treatment is to lower the pressure inside your eye. This helps protect the optic nerve from further damage. The most common initial treatment for glaucoma is prescription eye drops. These drops work by either reducing the amount of fluid your eye produces or by improving how well the fluid drains from your eye. It is very important to use these eye drops exactly as prescribed by your doctor. They are often a lifelong treatment. Just like taking medication for high blood pressure, these drops need to be taken regularly to keep the eye pressure under control. If eye drops are not enough, or if they cause too many side effects, your doctor might recommend laser treatment. There are different types of laser procedures for glaucoma. For open-angle glaucoma, a common laser treatment is called selective laser trabeculoplasty, or SLT. This procedure uses a low-power laser to help the drainage system in your eye work better. It usually takes only a few minutes and is done in the doctor's office. It can help lower eye pressure for some time, but the effect might wear off, and you might still need eye drops afterwards. For angle closure glaucoma, a different laser procedure called peripheral iridotomy, PI, might be used. This creates a small opening in the iris, the colored part of your eye, to improve fluid flow. In some cases, if eye drops and laser treatments are not effective enough, or if the glaucoma is very advanced, surgery might be necessary. There are several types of glaucoma surgeries. One common surgery is called a trabeculectomy. In this procedure, your surgeon creates a tiny new drainage channel in the white part of your eye. This allows fluid to drain out more easily and helps lower eye pressure. Another option involves implanting tiny drainage devices, often called tubes or shunts, to help fluid drain from the eye. The type of treatment recommended will depend on the type of glaucoma you have, how severe it is, and your overall health. Your eye care professional will discuss the best options for your specific situation. The most important takeaway for both cataracts and glaucoma is the importance of regular eye exams. For seniors, these regular checkups are truly essential. They are your best defense against these and other eye conditions. So how often should seniors have their eyes checked? Generally, if you are 65 or older, it is recommended to have a comprehensive dilated eye exam at least once every 1 to 2 years. However, if you have certain risk factors, such as a family history of glaucoma, diabetes, or if you are experiencing any changes in your vision, your doctor might recommend more frequent exams. Always follow your eye doctor's specific advice. What can you expect during a comprehensive eye exam? It is more than just reading letters off a chart. A comprehensive eye exam typically includes several important steps. First, the eye doctor or their assistant will usually ask about your medical history and any symptoms you are experiencing. They will also check your visual acuity, which is how clearly you can see at different distances. This is where you read the eye chart. They will check your depth perception and your side vision. Then, they will check your eye pressure, often with that gentle puff of air we talked about. Next, they will usually put special eye drops in your eyes to dilate or widen your pupils. This part takes a little time, usually about 15 to 30 minutes for the drops to work. While your pupils are dilated, your vision will be a bit blurry and you will be sensitive to light. It is a good idea to have sunglasses to wear after the exam and perhaps arrange for someone to drive you home, especially if you are not comfortable driving with blurry vision. Once your eyes are dilated, your doctor will use special instruments to examine the inside of your eye. They will look at your optic nerve, retina, and the lens of your eye very closely. This is how they can detect cataracts, glaucoma, and other conditions like age-related macular degeneration or diabetic retinopathy. They might also use other tests, like the visual field test we discussed earlier. If they have concerns, do not hesitate to ask your eye care professional questions during your exam. You might want to ask, what is the health of my optic nerve? What is my eye pressure? Are there any signs of cataracts or glaucoma? How often should I come back for my next eye exam? Are there any changes I need to make in my lifestyle to protect my eyes? Being informed is empowering. Let us also take a moment to clear up some common myths about eye health. Myth number 1. You do not need an eye exam unless you have symptoms. This is false, especially for conditions like glaucoma, which often have no early symptoms. Regular eye exams are crucial for early detection, even if your vision feels fine. Myth number 2. Losing your vision is an unavoidable part of aging. While some age-related changes are normal, significant vision loss is often preventable or treatable. Many serious conditions like cataracts and glaucoma can be managed, especially with early detection and treatment. Myth number 3. Wearing reading glasses will make your eyes worse. This is not true. Reading glasses simply help your eyes focus better on close objects. They do not weaken your eyes or make them more dependent on the glasses. Myth number 4. You can feel high eye pressure. Again, false for most people. High eye pressure, which is a risk factor for glaucoma, usually causes no pain or symptoms. That is why regular measurement by your doctor is essential. Beyond regular eye exams, there are also lifestyle choices you can make to help support your eye health. These habits can contribute to overall wellness, which in turn benefits your eyes. First, a healthy diet is incredibly important for your eyes. What you eat can have a big impact. Focus on foods rich in antioxidants. These are substances that can help protect your cells, including your eye cells, from damage. Think about adding lots of colorful fruits and vegetables to your plate. Leafy green vegetables like spinach, kale, and collard greens are particularly good. They contain important nutrients like lutein and zeaxanthin, which are like natural sunglasses for your eyes. Try to eat a serving of these greens a few times a week. A serving of spinach, for example, is about 1 cup cooked, which is roughly the size of a baseball. Orange and yellow fruits and vegetables like carrots, sweet potatoes, oranges, and bell peppers are also packed with vitamins that are good for your eyes. Also include foods rich in omega-3 fatty acids. These healthy fats can help protect against dry eyes and may play a role in preventing other eye conditions. Good sources include fatty fish like salmon, tuna, mackerel, and sardines. Aim to eat fish about 2 to 3 times a week. A typical serving of salmon is about 3 to 4 ounces, which is roughly the size of a deck of cards. If you do not eat fish, you can find omega-3s in flax seeds, chia seeds, and walnuts. Some people also consider taking a daily multivitamin or an eye-specific supplement, especially if their diet is not always balanced. However, it is always a good idea to talk to your doctor before starting any new supplements. Second, protect your eyes from the sun. We talked about how sunlight can be a risk factor for cataracts. Wearing sunglasses that block 99 to 100% of both UVA and UVB rays is crucial. Look for labels that say UV 400 or 100% UV protection. Wear them whenever you are outdoors, even on cloudy days, because UV rays can still penetrate clouds. A wide-brimmed hat can also provide extra protection by shading your eyes and face. Third, do not smoke. We already mentioned this as a significant risk factor for cataracts and glaucoma. Smoking increases your risk for many health problems, and eye diseases are no exception. It damages blood vessels throughout your body, including those that supply your eyes with nutrients. If you smoke, quitting is one of the very best things you can do to protect your vision and your overall health. There are many resources available to help you quit if you need support. Fourth, manage your underlying health conditions. Conditions like diabetes and high blood pressure can have a direct impact on your eye health. Poorly controlled diabetes, for example, can lead to serious eye complications, including diabetic retinopathy and an increased risk of cataracts and glaucoma. High blood pressure can also affect the delicate blood vessels in your eyes. Working with your doctor to manage these conditions through medication, diet, and lifestyle changes is vital for protecting your eyes. Fifth, stay active. Regular physical activity is good for your overall health, including your eyes. Exercise can help maintain a healthy weight, improve blood circulation, and reduce your risk of conditions like diabetes and high blood pressure, all of which indirectly benefit your eye health. Aim for at least 30 minutes of moderate exercise most days of the week, such as brisk walking, swimming, or cycling. In summary, our eyes are precious, and protecting our vision as we age is incredibly important for maintaining our independence and enjoying life to the fullest. We have learned that cataracts involve a clouding of the eye's natural lens, leading to blurry vision and difficulty with glare. Glaucoma, on the other hand, is a more silent condition that damages the optic nerve, often due to high eye pressure, leading to gradual and irreversible vision loss. The key takeaway for both conditions is this: early detection is absolutely vital, because glaucoma often has no symptoms until significant damage has occurred. And because cataracts can start subtly, regular comprehensive eye exams are your most important tool. These exams, especially with pupil dilation, allow your eye care professional to spot problems early, sometimes even before you notice any symptoms yourself. Catching these conditions early means that treatment can begin sooner, helping to preserve your vision and prevent further loss. Do not wait until you notice a problem with your vision. Make proactive eye care a priority. If you are 65 or older, or if you have risk factors like a family history of eye conditions or certain medical conditions, speak with your doctor about how often you should have your eyes checked. Take care of your eyes, and they will take care of you. Thank you for watching. If you found this information helpful, please give this video a thumbs up and share it with your friends and family. Your vision is a gift. Protect it. Schedule your comprehensive eye exam today.